Eating disorders. What are they? Bulimia nervosa is an eating disorder that involves cycles of overeating and purging, or attempts to rid the body of food. People with bulimia go on binges, eating a huge amount of food in a single sitting. After the binge, they purge, forcing themselves to vomit or take laxatives to flush the food out of their systems. Instead of purging, some people with bulimia may fast or exercise frantically after a binge. Most people who suffer from bulimia are typically in the normal weight range for their age and height. However, they share the fear of weight gain and dissatisfaction with their bodies. Health consequences include dehydration, sore and inflamed throat, and swollen glands. The teeth may also become damaged by exposure to stomach acid from vomiting. They may also damage their stomach, intestines, or kidneys. In severe cases, the chemical imbalances that result from purging can lead to irregular heart rhythms, heart failure, and death. Eating disorders are extreme, harmful eating behaviors that can cause serious illness or even death. They are classified as mental illnesses and are often linked to depression, low self-esteem, or troubled personal relationships. Social and cultural forces that emphasize physical appearance can also play a role. We'll talk about this more in the next lesson. Eating disorders often run in families. Genetics may also be a factor in their development. Another eating disorder is anorexia nervosa. It's an eating disorder in which an irrational fear of weight gain leads people to starve themselves. It mainly affects girls and young women. They see themselves unrealistically as overweight even when they are dangerously thin. The disorder affects a person's self-concept and coping abilities. Often, people with anorexia develop obsessive behaviors related to food, such as avoiding food and meals, eating only a few kinds of food in small amounts, weighing or counting the calories in everything they eat, exercising excessively, weighing themselves repeatedly. Health consequences of anorexia are related to malnutrition and starvation. The bones become brittle, body temperature, heart rate, and blood pressure may drop, and there may be a reduction in organ size. It can also lead to heart problems and sudden cardiac death. Binge eating disorder is an eating disorder in which people overeat compulsively. They eat large amounts of food in a short period of time. During a binge, the person may feel guilty and disgusted about his or her behavior, but feel powerless to stop it. Binge eating disorder is more common in males than any other eating disorder. Consequences include becoming overweight or obese. People with binge eating disorder do not purge. They can also develop the health problems associated with obesity, including high blood pressure, type 2 diabetes, and cardiovascular disease. Eating disorders are serious and dangerous illnesses. People with these disorders need help to overcome them. Medical help may involve counseling, nutritional guidance, a doctor's care, and in extreme cases, a hospital stay. People with eating disorders often cannot admit that they have a problem. Family members and friends can help them recognize the problem and seek treatment. If you think that you or somebody you know may have an eating disorder, talk to a trusted adult, such as a parent, counselor, or school nurse.